Hello, I'm Janis Paulson, CEO of Unitek Learning, and I'm excited to share a bit about our history, mission, and vision for the future of healthcare education. At Unitek Learning, we believe that healthcare providers should be representative of the communities they serve. When this is true, the ripple effect of the entire community is truly life-changing. The impact ranges from poverty to healthcare outcomes. When patients see themselves in the healthcare workforce, it raises trust and encourages preventative care. When career paths with better than good wages are available and allow people to stay within a community, the wages also stay and benefit everyone. When we say healthy communities, we mean in all regards: physical, mental, and financial. Improved access to healthcare leads to healthier communities. Our organization is committed to diversity and inclusion within healthcare. Let me share just a few numbers to back up that statement. In 2020, Unitek Learning Schools graduated over 6,000 students from its nursing and healthcare programs. More than 70% were minorities. 1,200 of these graduates were within a nursing program, and nearly half, 49%, were people of color. Unitek Learning is incredibly proud to be at the forefront of changing access to healthcare education. Our graduates far outpace the percentages of people of color within nursing, tying actual results to our goal of improving access to healthcare for the communities we serve. Unitek Learning is a growing and vibrant group of schools focused solely on healthcare education. Our brands include Unitek College, Provo College, Eaglegate College, and Brookline College. Our schools offer a broad range of healthcare programs, from medical assisting to master's degree in nursing. Our goal is to help communities reduce and even solve their healthcare workforce shortages, to ensure equity and access to healthcare and help communities become and stay vibrant. We are located in the Western United States and teach in every learning modality, including custom content and short-term post-degree certificates. Our campuses are in urban and rural areas alike. We teach in communities where healthcare workforce shortages are some of the most severe in the country. We specialize in educating non-traditional students who tend to stay and work within the communities we serve and have a track record of successful outcomes with diverse populations and mid-career students. We partner with more than 800 hospitals and clinics across multiple geographies. Welcome us and open their doors for the best clinical experiences for our students. And in turn, we provide them with a continuous pipeline of qualified practitioners ready for hire. It is through these clinical relationships that we do some of our most meaningful work. Our partners share their pain points with us and provide input on the skills they most need in their workforce and in their community. Our time together today will be spent sharing ideas on how to address these significant workforce challenges, to learn from and be inspired by each other. Now, I'd like to turn the presentation over to our Provost and Chief Academic Officer, Dr. Abdel Yosef.
Well, home health care is one of the fastest growing sector in healthcare. In fact, 10,000 baby boomers reach the age of 65 every year, and 90% of them wants to age in place, which is usually home. 75% of the Americans over the age of 65 live with multiple health care problems that are difficult to manage without help. The labor shortage is perhaps the largest threat to the home health care industry today. In the US alone, by 2026, the industry will need roughly about 1.3 million home health care aides and 2.7 million personal care aides. Well, 3 years ago, this was presented as a future vision. People talked about delivering of care at home, and most care will be delivered at home. But nobody thought about how fast this could happen. Last year in the pandemic actually accelerated that. Now every healthcare system, number one priority for them is to trying to move as much care as possible at home. As hospitals realize that the future is to provide care at home, they realize that they need help, mostly from home health agency and home care agencies. And also, we can't forget technology. Technology companies need to provide that monitoring platform and equipments to make home health safe and effective. Well, in an effort to increase hospital capacity amid the current COVID-19 surge, the U.S. Center for Medicare and Medicaid Services, CMS, in November 2020 announced flexibilities around providing hospital-level care for patients in their homes. These flexibilities aren't coming out of thin air. Instead, they build off the success and the learning of the nation's existing hospital home models, pioneered by organizations like Johns Hopkins and Mount Sinai. The recent plan released by President Biden with a $2 trillion spending in infrastructure, it allocated $400 billion on home-based care for the elderly and the disabled. And that is a huge fund for home health and home care that's going to provide better services for our aging population. I believe academia has not kept up with this move of moving care to home, because if you examine any generic curriculum for nursing, you will find few chapters here and there, but the content and even the clinical experience the students receive that is focused on home health is very limited. I believe home health as a concept, it should be an embedded thread or a curricular thread throughout the courses, because it's a very important field and we need to prepare our nurses to choose home health as one of the fields that they would like to provide care. Integrating simulation and technology in education when it comes to home health is very vital. As we mentioned, there is a limited opportunity for students to practice in home health. So we need to start by the virtual reality simulation, where we can take them through that platform to a patient home so they can learn clinical reasoning and decision makings, and can also work with patients with multiple comorbidity and multiple chronic diseases. Our colleges at Unitek Learning are all partners with Gene Watson Caring Science Institute, and we believe caring is the essence of nursing. Home care, what drives people to provide care at home is their passion and their calling and their caring, and we are well positioned to provide education, even as a smaller courses or post-certification, and also integrating these home health concepts into our courses and our programs to be able to provide quality and quantity, because we need more. As the numbers shows, we need more healthcare providers in this field. Today, we're excited to bring together a group of leading experts in the field of home health. We will start the day with our keynote speaker, Dr. Bill Emerson, former California State Senator, who will share his expertise on the lessons we have learned from the pandemic from a global health perspective and the shortage of home health care providers. Then Tracy Cruz, the former Chief Operating Officer of the Home Health and Hospice Division at Encompass Health, will share her knowledge and vision on home health care. Marianne Christopher, Senior Operating Officer at LLR Partners, will lead our panel discussion on urgent nursing workforce needs with experts and specialists in the field of healthcare and education. Later in the morning, Jean Parker Martin, the President and CEO of Leading Edge California, and Dr. Rain Soriano, the Regional Director of Patient Care Services at Kaiser Permanente, will share a presentation on how organizations partnered together to solve the workforce challenges. I want to thank our distinguished panelists and industry leaders that are generously giving us their time and their knowledge in our shared mission to improve home health care and help bridge the gap between academic and practice. This conference would not have been possible without their partnership. I also want to take a moment to thank our community partners and exhibitors that are here today. It is my hope that you will discover something new and take away knowledge or tools that you can incorporate into your daily practice to make a difference in the lives of your fellow colleagues, students, and clients. It is my honor now to turn the conference over to Dr. Stephanie Robinson, our Regional Associate Dean of Nursing, who will be kicking off our day. Thank you.